The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. Teachers across the state and here in the Susquehanna Valley are now getting vaccinated. The goal to get more students back in the classroom for in-person learning. Tonight we have a full house of teachers, a student, a superintendent, and a union leader. We'll look at the process to get teachers their shots and what it's been like learning and teaching during a pandemic as we bring the return to the classroom in focus. Joining me now is the president of the Pennsylvania State Education Association, Rich Askey. Thanks for joining us, Rich.
Thank you. I'm looking forward to it.
Boy, things are certainly different than they were a year ago here in Pennsylvania and the school districts.
Very much so. Very much so. The vaccinations have made a huge difference, and the program is going extremely well. We had secured 94,000 vaccines for the first round of Johnson & Johnson. And what I heard is so far there is about 52,000 educators across Pennsylvania that have taken advantage of the program.
Are you finding any vaccine hesitancy among teachers?
We've had a little bit, but what I've advised the members who have come to me and asked, I said, go back and talk to your physician and get the advice from your medical doctor. And it's up to them to make their choice for themselves.
How do you think teachers being vaccinated is making a difference in terms of going back into the classroom?
Well, since the beginning of the pandemic, we've been really advocating for safety in our schools. And this is just that extra layer of safety. And I think it's going to have a big effect in bringing more of our students back into classrooms. So this is truly a big deal that is going on.
The CDC is also considering changing some of the guidelines for schools, including allowing students to sit 3 feet apart as opposed to 6 feet apart. What's the reaction to that?
Well, you know, this has been a big discussion since the very beginning. Some folks were saying 3 feet. But we've always said, listen to what the science says. And we're still going to say that. If the CDC comes out after doing all these reviews and says 3 feet, then 3 feet it is. And actually, that will bring more of our students back into the classrooms, which is what we want.
Some districts have argued they don't have enough space to separate students 6 feet apart.
That's been a very big problem. And I think if it changes to the 3 feet, you're going to see more schools move away from hybrid and go into more in-person 5 days a week learning, which our kids need that. Our kids need that.
What are you hearing from teachers who are returning to the classroom?
Oh, I've never had so much fun looking at the social media of our members. They're taking pictures with their students, of course, socially distanced and masked and everything, but the teachers are celebrating. This has been very stressful for everyone, for all of us, but it's been very stressful for our students and for the teachers to do this kind of instruction where you have these different platforms where you're teaching some in person and you're teaching at the same time, you're teaching some online. And it's just been stressful. They want to get closer to being normal again.
What are you hearing in terms of numbers? How many districts are back in the classroom or still continuing the hybrid or the virtual learning?
What we're hearing is about 2/3 of the schools in Pennsylvania. That's the last I heard. 2/3 of the school districts in Pennsylvania are back in some form, whether there's schools that have been full force since September and there's schools that are still hybrid. But I do know that it seems like every week there are more schools that are bringing students back into their classrooms. I do think that the vaccine is going to make a huge difference in that.
Yeah, there's a comfort level there. How important do you think it is for students to be back in the classroom?
Extremely important. Academically, the delayed learning has not been, just hasn't been as successful as we would like. We all know that the best place for kids to be is in the classroom with their teachers. And one of the big, any instructor will tell you, proximity is really important technique to teaching. You want to be by your child. You want to be close to them when they need a help with a problem. So we're going to see the kids come back and we're going to have to take care of them academically, and that's going to take some time. We're going to have to assess where they are. But we're also going to have to take care of them socially and emotionally. This has been stressful for our young folks, and we're going to have our social workers, our counselors, our nurses are all going to be very busy taking care of their kids. And if I can, just to say to the parents, if you feel your child is in some place where they need an extra attention in that area, reach out to your school, because there's professionals in your school that can help you with that.
Obviously, this has changed the face of education and educators, hasn't it, this entire year?
Yeah, I don't know that it's ever going to be what it was, but I think it's going to be better in the long run. You know, we're still going to have to maintain some of the health practices with the masks and those type of things, but I think we were forced in to take a leap in technology. So I think when you look at the whole event, that you've got to see, yes, there's going to be some issues, but there's some silver lining to it, where I think you're looking at new areas of instruction.
All right, very good. Well, thank you, Rich. We appreciate you being here. And coming up on WGAL 8 in Focus, we'll speak with 2 teachers from the School District of Lancaster about the return to the classroom.
This is WGAL 8 in Focus, coverage you can count on.
We continue our discussion on the return to the classroom and the vaccination of teachers with 2 teachers from the School District of Lancaster. They are Stacy Wilson and Kristen Haase. Thanks, both of you, for being here.
Thank you.
Thank you.
I know you both teach English as a second language. Stacy, I'll start with you. What is it like to return to the classroom, which you did in January?
It's fantastic, Susan. Teaching in person is so much more powerful than teaching virtually, because we have that one-on-one connection with the children, especially with our kids who need that extra support with their language and their tech support.
Why wasn't virtual learning working so well? I know you both wrote an op-ed piece for the newspaper. Why do you think it wasn't working, Kristen?
I think there were a myriad of issues of why it wasn't working. Like Stacy said, there were technology issues. Also with our population, our parents voiced concern about not being able to help their children access the language and the curriculum because it was all in English. So those are 2 of the top reasons I believe it was very challenging for our population.
Do you agree with that, Stacy?
I agree. Yeah, so in fall, I was doing a lot of front step teaching, because my ESL children were not logging on because they didn't understand the process of how to log on. Even though we'd given multiple examples of that, parents just were very frustrated and just shut down. So I went to their doorstep to make sure that they were getting their lessons.
You actually went to their homes?
I did, not inside their homes, on the outside doorstep.
Wow, that's a dedicated teacher. So tell me, what does it feel like now you're back in the classrooms in terms of safety? How about for you, Stacy?
Well, I feel very safe. So we have lots of safety protocols in place at our school, where we have hand sanitizing, we have rigorous mask wearing, we have kids who know that the mask has to be over their nose, not below their nose. We have walking protocol in the hallway, so it's a one-way pattern. I just feel very safe.
How about you, Kristen? Are the students complying with all of this?
Yes, they are. And I believe too, the parents are on board with this too, because they're sending their students to school with masks every day. And the students are just doing great, following all the guidelines that our school and other schools in the district had set in place. That these protocols were in motion before we even started back. So I feel that we're, as a collective group, we are doing an excellent job.
And I know you both have been vaccinated. What made you get the vaccine?
Well, for me, I wanted to be uber safe. I want to be here. I want to be present with my children, and I don't want to get sick. So that's why I was first in line to get the shot.
And I want to be seen as a leader, and that the importance of this getting vaccinated. And when the school district was offering vaccinations to the first wave, which I believe was 600 to the elementary staff and the bus drivers and cafeteria workers, I think we all wanted to make sure we were doing our part to stay safe.
Well, that's a good thing. What kind of impact do you think this challenging year will have on your students and on you as educators, Stacy?
It's definitely a lesson of perseverance. Impact is going to be felt for years to come, unfortunately. I think that we just have to address those needs as they arise next year and continue to do the very best we can this year.
Clearly, some students are going to be behind because of this, aren't they, Kristen?
Yes, but the school district is doing its part. We are offering at Carter McRae specifically, we're offering a Saturday program for our students. We're also offering an intensive summer program to students across the district. So we definitely have some ideas in place to get students where they need to be moving forward. And I want to say too, I think that this has also brought about a partnership between the community, the parents, the students, and the teachers working together to serve, the students of the school district of Lancaster. We have been able to form relationships with our parents throughout all of this, and I think we're, just going to continue growing that partnership and moving our students to where they need to be.
Well, maybe that's the silver lining in all of this. Thank you so much for joining us. We appreciate it, and good luck for the rest of the school year.
Thank you for having us.
And coming up on WGAL 8 in Focus, we'll speak with a superintendent about how his district has stayed in school the entire year.
This is WGAL 8 in Focus, coverage you can count on.
Joining me now is Dr. Todd Klein. He's the superintendent of the Waynesboro Area School District in Franklin County. Thanks so much for joining us.
Sure. Thank you, Susan.
We're talking about schools reopening, but your school district has managed to stay open almost consecutively since August. How did you make that happen?
Well, first, it takes the people of our district. We had the support of our school board, which ironically is made up of 6 former school teachers from our district out of the 9, and a lot of support from our support staff, our administrators, and our teachers and our other support staff members. Without them, it wouldn't happen. Plus parents. Parents followed our protocols, made sure if kids were sick, we sent them home. If they were exposed to positive cases at home, we quarantined them. I think that's the only way it would have worked.
And it has worked. You said your rate of sickness in the district has been relatively low all these months?
It has. The state showed between ages 5 and 18 that the positivity rate was about 7 to 8%. For us here, it was 2% of our student body. And our staff, the average age of those who got sick was 45. And in that age range for the state, I think was 36%. And of our staff, 12% had gotten the virus.
What have you done physically in your schools?
We've added some plexiglass when teachers and others had asked for it. We tried to add as much as we reasonably could. We put dividers between small groups. We didn't put dividers between desks. A lot of our students were within an arm's length apart from each other. We put stations for hand sanitizer. Kids got in the habit of washing their hands. Again, our protocols for if a student showed any kinds of illness at all, signs of that, they were sent to the nurse examined them, and sometimes they were sent home. But I think all of those things, plus the support of all of our people being very vigilant, is why it worked.
You did get some pushback from teachers. How did you handle that?
Yeah, we did. Well, part of it was difficult because it was a busy time, and I'm actually the pandemic coordinator for the district. So very time consuming, but a couple of the teachers wanted to talk to me, and actually a couple board members joined me to show support that they're behind being open. And we went and talked to the teachers. I think it helped them at least understand our point, and we tried to hear their point. But there was a formal complaint filed with the state saying that we weren't following the mask rule, and also that we were not following the closure matrix. And we had a bunch of things to send in back in December to the state, but the state actually sent back to us and said, just keep enforcing the masks and keep following the matrix. They found nothing wrong. And our data is pretty good. Our solicitor even said that we're kind of an anomaly, and that the data that we sent was probably more than the state had.
How do you think this has helped your students?
Well, I think in a lot of ways. Academically, obviously they're in school, and I'd rather most kids are better off with an adult in the room leading the learning, helping coordinate that. Some kids do well online. I can't deny that, but most kids do better with an adult there. So I think that is definitely has been a benefit to our kids. 80% of them are in school. 20% chose other options. But of those 80%, I think they've done fairly well. We've had some issues with kids having to be quarantined even as many as 3 times. So that's a problem, but they were in school. The other part of it is their psychological growth and the social growth. We think those were positive things for our kids that others that were online didn't get.
And just very quickly, in terms of cost, I know you'll be getting some money from the stimulus package. Obviously, this does cost school districts more money, doesn't it?
It absolutely does. With the cost, even from our ESSERS money that we have gotten previously, we've spent most of it to cyber charters. We've put it into safety costs and as much as we could, but a lot of our money had to go into technology for cyber charter students that have left the district to go to a cyber charter school.
Dr. Klein, thanks so much for joining us.
Thank you, Susan.
And coming up on WGAL 8 in Focus, we'll hear from a Waynesboro student about being in the classroom during a pandemic.
This is WGAL 8 in Focus, coverage you can count on.
With us now is Sophia Johnson. She's a senior at the Waynesboro Area High School. Sophia, nice to meet you, and thanks for being here.
Of course, thanks for having me.
What has this school year been like for you?
Interesting, to say the least. To start, I've been quarantined 3 times. So I've been in person a good bit of school, but I've also been out of school a good bit. And it's been hard to adapt, but it's happened. And I think taking this experience with me is really going to be a good benefit to me in the future.
Wow, well, that's a positive way to look at it. I know your school has been mostly in person all year, which is a good thing, but you have had some virtual learning. What do you see as the differences and maybe the downside of one or the other?
Definitely the downside that I know about virtual learning is being able to hear and interact with your classmates. Whenever I was quarantined, the rest of my students or my classmates were in class, and there's a big difference between interacting during school and then interacting over like a computer. And it's definitely a downside. You can't really get the same one-on-one that you can at school with their teacher. So I think learning and also hearing over the microphone is kind of difficult sometimes.
Is it harder to stay focused?
Yes, very, very hard to stay focused.
And what about being in school? Have you felt safe? What have been the challenges with that?
For the most part, I've felt very safe. Sometimes it's just a little bit hard to social distance in classrooms because we are kind of a bigger school. So sometimes we are in classes with more kids, but our teachers are very strict about keeping our masks on, washing our hands, passing papers out, and just being, very cautious of what's going on. So I felt very safe being here.
And we might add, you do have your mask with you. You're in a room by yourself, hence the reason you took off your mask. But you normally would. What's that like to be masked all day and interact with people like that?
whenever I see people without a mask, it's like, where is your mask? Or, oh, that's what you really look like, because I haven't seen people without a mask on for so long. And it's like you can't really get to know the full person without seeing their full face. But I think once everything is done with and not having these masks, we'll really be able to get to know each other as we should be.
Wow. What do you think you've learned from being in school and facing these challenges this whole year?
I've learned how to adapt and to, kind of change my switch on the fly. Because we went from being in school one week to being out of school the next week, and then in school and then out of school. So you really have to learn how to adapt and how to kind of overcome. And I think with that, it's very good for at least my generation to take that and run with it for whenever we get older, because life is going to throw things at you that you're going to have to adapt and overcome very quickly. So I think overall with that, we can take some big things away from what we're going through right now.
Well, it sounds like you're looking at the positive of this whole thing, that's for sure. I know you're
trying to.
Yeah, tell me about your plans. You're going to college. What's that going to be like for you?
I am so excited to go to college. I kind of picked my school in February. So we've just been in the process of just making sure that everything's done, finding a roommate, which I still haven't found a roommate, so that's kind of stressful. But I'm very excited just to get to a different atmosphere and really just meet new people.
Well, we certainly hope the college experience is more normal when you attend next year.
Yes.
And you're going to continue to play volleyball?
Yes, I am.
Oh, that's great. Well, we wish you the best of luck. I appreciate you being here. Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro. And join us again next Saturday night at 7 o'clock for WGAL 8 in Focus after NBC Nightly News.